Thank you, Governor, and thank you, Mr. Morgan. And I'll just say that if NC State can make it to the championship next year, we might have something to show for it. So I don't think there's really much I can say after that passion, that candor, and just that true example of leadership. But I will say that Governor Kasich showed us that that even just one policy change, one lever, can make a broad difference across the state, across geographies, and across issues. So I'll just entreat you that it is time to overcome the divides that we have fabricated and recognize the opportunity to do good for our people. It's time to let elected leaders know that we have their back in making difficult decisions. It is time to close the coverage gap in North Carolina. Before I switch to our next speaker, I want to fact check myself really quickly, have a red buzzer going above my head. Earlier I said the hospital in Little Washington is facing bankruptcy. That is actually Washington County. So all those folks who are running to check on Beaufort County's hospital, don't worry, it's fine. I apologize for that. So I'm now pleased to introduce a perfect follow-up to this conversation. Attorney General Josh Stein is the 50th Attorney General of North Carolina and has made combating the opioid crisis in North Carolina his top priority. He was instrumental in drafting and promoting the STOP Act in 2017, which was approved unanimously by both houses of the General Assembly. Talk about bipartisanship. And since then, he has continued to work on steps to address the substance abuse problems that are afflicting so many of our families and communities. Here to make a special announcement about an exciting new collaborative initiative to take that step further, please welcome North Carolina Attorney General Josh Stein.
Two minutes left. Good morning. How are you all? It is a pleasure to be with you, John. Thank you for that introduction. Thank you for the invitation to join you all today. It is great to be here at Rural Day. There are so many critical issues facing our rural communities here in North Carolina, and we will only make progress with focus and effort. And I thank the important work that you all are doing on sharpening the focus for policymakers to make a difference for the rural parts of our state. I want to focus my comments today on the gravest public health and public safety issue facing North Carolina today, and that is the opioid epidemic. Governor Kasich of Ohio, what a treat it was for us to have him here today, and I know he was an early adopter and remains a strong proponent of expanding Medicaid to provide health insurance for folks in rural parts of our country. I want to just say this one comment as a prefatory comment before I get into the bulk of my remarks, and it is, if the state of North Carolina were truly serious about the opioid epidemic, the single most effective step we could take to confront it would be to accept the federal government's offer to return our taxpayer dollars to us in the form of Medicaid expansion. Over these past couple years, I have traveled the state extensively, holding a couple of dozen or more community roundtables to discuss the opioid epidemic, many of these occurring in rural North Carolina. I wanted to understand the problem and some of the solutions that communities are putting forward. And in the process, I met many people with powerful stories. I learned about Caleb, a star baseball pitcher, who got a college scholarship and pitched. He tore his rotator cuff, had surgery, was prescribed a number of pills to which he became addicted, and sadly that young man overdosed and died. I met a young man named Ethan from Pitt County. His mother had knee surgery when he was 12, and she was prescribed a ton of pills. Teenage boy with not enough sense, he went into the medicine cabinet and started messing around and became addicted. By 15 years old, he was on heroin. By 18, he was homeless, living in a Walmart parking lot. Well, he is 21 years old, putting himself through ECU in order to become a counselor for young people. There are tens of thousands of stories like Caleb's, like Ethan's, in North Carolina, and what our imperative must be is to make sure that we have a whole lot more Ethans and no more Calebs. Sadly, drug overdoses is the number one cause of accidental death in North Carolina, more than car crashes. For decades, car crashes were the leading cause of accidental death. It's now overdoses. 5 North Carolinians will die today, on average, from an opioid overdose. 2,000 people died in 2017 from an opioid overdose. It was about a 25% increase over the number who had died in 2016, making North Carolina experience the second largest increase in the entire United States. There is a painful impact on rural communities. The overdose death rate in rural counties is nearly 5 times larger in 2016 than it was 15 years earlier. Opioids do not care who you are. They don't care if you are old or young, if you are black or white. They don't care if you live in the city or the country. They don't care if you're a Democrat or Republican. They come and grab hold of you and become an all-consuming compulsion so that the primary motivation every day is for a person to find that morphine molecule. They are insidious. The human cost is incalculable. There is no way to put a dollar figure on the number of years a person with addiction suffers in pain, or the family or friends of that person. But we can estimate the economic cost. The President's Council of Economic Advisors in 2015 put the price tag at $500 billion. This includes cost of the healthcare system, our criminal justice system, our social services. We're seeing skyrocketing foster care. And the biggest cost is borne by the private sector in lost productivity. This workforce issue is a critical issue for the economic future of rural North Carolina. I talked with some folks in Rutherford County. There was a manufacturer there, and for every job that they posted, they'd get 5 applicants. 2 would not pass the drug test, and 2 more had a criminal record because of a drug past. 80% of the job applicants were just weeded out from the get-go. How are we going to make attractive location options for companies if the workforce isn't able to do the job? There was another company, a major company in Wilkes County, that in addition to the salaries that they paid their workers, if workers showed up 5 consecutive days, they would get a bonus. That's how desperate they were to keep their workers on the job and to not lose the productivity. Look, this is a bleak situation. There's no way to sugarcoat it. The problem actually will likely worsen before it gets better because there are so many thousands of North Carolinians struggling with addiction today. But if we work together, if we all do our part, we can turn the tide on this crisis and we can save lives. It requires being smart, having a comprehensive strategy. I'm focused on prevention, treatment and recovery, and enforcement. And I'll talk briefly about each. On prevention, it's important to understand, how did we get to this point? What happened over the last 20 years? Basically, 2 phenomena occurred at the same time. One, we had drug manufacturers telling our doctors and prescribers that opioids are the most effective way for treating pain, and by the way, they're not addictive. Turns out neither of those things are true. The second was we started looking at pain in the United States in a different way than the rest of the world. We told the medical world we want to eliminate pain, not manage it. In fact, we evaluated doctors and hospitals on how effectively they treated pain. Pain became the 5th vital sign. You put those 2 developments in play at the same time, and we had a major spike in opioid prescriptions. In North Carolina, there was approximately a prescription written for every man, woman, and child in the state last year. About 500 million pills prescribed. That's 50 pills per person. And it's particularly problematic in rural areas. And 2016, retail opioid sales per capita were around 50% higher in the country than it was in the city. 50% more pills in the country. When you look at the United States as a whole, we prescribe 10 times more opioids per capita than does Japan, 4 to 5 times more opioids per capita than does Europe. We do not have 5 to 10 times more pain in the United States than those countries do. To reduce overdose and addiction, we have to reduce overprescription. For some, all it takes is one prescription. I met a guy in Jacksonville who had a motorcycle accident, busted his knee up. He said after 5 days, he was gone. He knew he was gone. And he told me a story about living on the streets in Wilmington for about 12 years, and the way he described it, it sounded like a personal hell. The CDC reports that 20% of all people who get a prescription and take that prescription for 10 days, 20% of them will be taking an opioid a year later. That's how addictive these things are. For those who only use a few pills, that they're fortunate, they're the 80% who don't get addicted, they put the extra in the medicine cabinet. That's what we all do. Well, young people and to people with addiction, those pills are a magnet. I told you about Ethan's story. He's not alone. 2/3 of all young people who misuse opioids get them from families and friends. They're raiding our medicine cabinets and misusing the pills, becoming addicted. My office drafted the STOP Act. The General Assembly passed it unanimously, and the governor signed it into law in 2017. And the whole intention is to reduce overprescribing of these addictive and dangerous pills. It requires doctors to consult a database to make sure folks aren't doctor shopping. It requires doctors to e-prescribe, to cut down on prescription pad forgery and theft. It sets a limit of 5 to 7 days of a prescriber for acute pain, as distinct from chronic pain. Chronic pain is not covered by this, and if we don't adequately treat pain, we actually run the risk of overdose again, because if people are in pain, they will treat themselves. And if the healthcare system doesn't take care of them, they will go to the street to do what they need to deal with their pain. That means that insurance companies have to pay doctors to provide alternative ways of treating pain than just throwing pills at the problem. Another critical part of prevention is consumer awareness, is for people to understand what is an opioid. I've heard about them, I don't know what they are. What's the relationship between opioids and our pain pills and heroin? How are they the same? How are they different? We at the Department of Justice have a partnership, and we're proud of it, with our Department of Health and Human Services. Secretary Mandy Cohen and I are going to unveil a new campaign next week called morepowerfulnc.org. The website is up and running, and we're going to give you all a sneak peek. You all are the first public audience to see this ad, so don't tell anybody you saw it. If the technology works, can y'all go ahead and play the ad?
North Carolina. Our state is such a beautiful place. But look closer. Closer. You might be surprised by what you see. There are millions of unused and leftover opioid pills in this state alone. And when you look closely, you start to see the problems, the misuse, the addiction, and the fact that opioid overdoses have doubled in the past 10 years. Almost 30 deaths every week. That's more than 5 every day. Oxy, Vicodin, Percocet, morphine. There are enough powerful opioid pills in North Carolina to stretch from the mountains to the beaches. And for many of us, the danger is right here at home, hiding in our own medicine cabinets. These unused and leftover pain pills are everywhere. They're overwhelming our state and devastating lives. But there is something more powerful than these pills, stronger than opioids. It's us. All of us. Together, we can take the first step in solving the problem. We can take back our unused and leftover pills. We can talk to our families about the risks associated with opioids. We can ask our doctors about alternatives for pain management. And together, we can overpower this deadly epidemic and take back our communities. To find a drop-off site near you or for resources and treatment in your area, visit morepowerfulnc.org.
What'd y'all think? Thank you very much. We're going to be launching it next week. As I said, it's a partnership primarily between DHHS and DOJ, but we also are partnering with the Commissioner of Insurance, the Department of Public Instruction, and our private sector partners. The primary ones are Blue Cross Blue Shield and Atrium Health System, but also LabCorp, UNC Healthcare, the Carolina Hurricanes. This is a true public-private partnership to try to educate the public on things that they can do, concrete actions to address this problem. And the website has basic information. Get the facts, get help, and get involved. So what I've talked to you about is prevention. And if we succeed at prevention and turn that spigot off so that not another new person becomes addicted, we still have tens of thousands of North Carolinians struggling with addiction today in North Carolina. And we are failing those people. Only 1 out of 6 people with opioid addiction got any kind of health care treatment last year. That is simply not enough. And the key, what I mentioned at the very beginning, the key thing we can do is in order to get the medication-assisted therapy a person with addiction needs, they need to be able to pay for the medication and the therapy. That means they need to have health insurance, and that's why Medicaid expansion is so absolutely critical. I assume the governor, I came in late to his remarks, that he told you how in Dayton, Ohio, they had a 54% decrease in opioid overdose deaths after they expanded Medicaid. It is about saving lives. So in addition to prevention and treatment, we need to do enforcement. We need to hold drug traffickers accountable, and the legislature has passed a couple of bills that I've asked them to do to give law enforcement those tools. But we also have to do a better job of transitioning more people out of the criminal justice system and into the healthcare system where they can get the treatment in a cost-effective way to deal with whatever it is that's driving their criminal behavior. That's another reason why having health insurance is so absolutely critical. I tell you, as I've traveled the state and met people who are struggling, sad, and broken from this epidemic, I also have been inspired by the so many other people whose lives have been transformed and who are helping to repair broken people. I've met brave parents like Mike and Becky Cannon of Wilson who, after losing their child to an overdose, have created a nonprofit where they engage other children struggling with addiction, help other parents cope with the loss that they experienced, and advocate for policy changes on prevention and treatment to tackle this problem once and for all. There are police and law enforcement leaders like the former chief of police of the town of Nashville, Thomas Bayshore, who will take anyone in the front door of his police station with whatever drugs and paraphernalia they have and personally escort them to treatment so they can get healthy. I've met folks like Jim Albright, the head of EMS in Guilford County, who got tired of having his folks go and tackle and deal with people who were dead or repeat overdose, so that now they've got a program where they come back and visit somebody post-overdose to connect them with treatment so that they can finally tackle their demons. Survivors like Ashley in Wilson County, who now lives in Nash County, who over a couple of years, typically, you get in recovery, you relapse. That happens. This is a chronic disease, but she's in long-term recovery, mother of 2 children, teaches art to other kids, and personally is a peer counselor with other people struggling with addiction. So there's so many people out there doing incredibly inspiring things, and it's our job And it doesn't matter where we come from, whether we're policymakers, whether we're business leaders, whether we're law enforcement or medical folks, whether business community, whether we're the faith community, we all have a role in tackling this crisis. And if we do that, if we work together, we can turn the tide, we can save lives, and we can make North Carolina safer, stronger, and healthier. Thank you for your time today.